I'm Dr. Abbas. I'm a GP at Swiss Cottage. I've got 14,000 patients. Health inequalities play a major part in obviously the work that I see. The main areas of concern are hypertension, diabetes, obesity, respiratory illnesses, mental ill health, among many other things. Why do I think this is happening? Well, there's genetic components of disease, but there are modifiable risk factors such as exercise or lack thereof and poor diet. Even though this is well highlighted in the media, this doesn't seem to be taken up. The themes that we see in these conditions are overeating, large portion sizes, eating foods that are high in processed fats, sugars and salt. These factors are often increase the risk of ischemic heart disease, stroke, obesity and cancer. We find people are reluctant to come in for their NHS health check or even routine health checks, and this can be harder still if they have long-term illnesses and mental ill health, although we are commissioned to try and improve this, and indeed we have managed to do so. The traffic light system on foods, I often mention to patients, but often they say that they don't have the knowledge to cook, the knowledge to understand about healthy eating, or the ability to cook. One family has just a hot plate and a microwave. That leads itself to an unhealthy diet in itself. We have exercise on prescription, which is very useful for GPs, of course, and our patients, but of course that's only limited to a certain number of conditions themselves. We have local green space in Swiss Cottage, and sort of exercise gym outside as well, which is helpful. And I wonder if these sorts of resources, which are used day in, day out throughout the year, could be expanded to other areas in Camden, perhaps using brownfield sites and also around social housing developments, of which I'm sure there must be some space available. Often it's a problem of temporary accommodation for my patients as well. I've got one hostel that is covered in tarpaulin, and they use the green spaces as a means to have light. We try to address this in Swiss Cottage with the help of our councillors. I must thank them, our ward council in Swiss Cottage, by creating a festival, a winter festival, which gave people a space and a time to go out. And we used the council space of the library when it got too cold. I dressed as Father Christmas. What it meant is that people were willing to engage when they have an opportunity to do so. In future, we will try to increase the offer in terms of engagement piece with community providers that might be able to provide resilience and support to our local community. Finishing on mental health, obviously that's increasing in its level of severity and frequency. I don't know if this is related to cannabis use, having stopped many people outside the surgery smoking cannabis and it permeating through my surgery walls. Not a good look for a surgery. And also, obviously, this culture of knife crime is also becoming more prevalent, having had that happen in Swiss Cottage outside our community centre. This obviously has a bearing on mental ill health, drug misuse. And of course, we're trying to address that through more complex clinics, which have greater time address it to them. That's all I need to say.